When Jesus says yes, nobody can say no. When Jesus says yes, nobody can say no. I'm not worried about a thing, 'cause I know you are guiding me. Where you lead me, Lord, I will go. I have no fear, 'cause I know who's in control. There's no limit to what you can do, 'cause it all belongs to you. Yes, it all belongs to you. You're almighty and all powerful, and it all belongs to you. Yes, it all belongs to you. When Jesus says yes, nobody can say no. 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 I'm not worried about a thing, 'cause I know you are guiding me. Where you lead me, Lord, I will go. I have no fear, 'cause I know who's in control.
Okay, viewers, good day everyone, and welcome back to Healthy Living with BOFA. Hope everyone is well and happy like I am. I'm your host, Betsy Adeyinka Akinlosotu. Like I always do before we bring our segment to your view, I like to educate on what this program is all about. Let's think about the goals you and I have for our health and the positive results we all hope to have. What do you want to achieve? To achieve this goal is the reason why Healthy Living with BOFA is set to touch and change lives in a unique way, especially the youth, less privileged and vulnerable in our community. This program features multiple segments, from today's news to nutrition, health, and wellness. Our nutrition program, which is segment tag, You Are What You Eat. Of course, we are all what we eat. This segment will be educating and sensitizing you and I on how to eat and live our way into healthy and beautiful body. While our health corner brings you information on health and how to maintain and prevent health challenges. Like I always say, wellness is not only about your body or my body, but everything around us. What you do, what I do, which seems not to, realized by you and I, that these are part of healthy living. To educate more on this, our interview segment features professionals from various and different fields, such as health, education, agriculture, nutrition, entrepreneurship, entertainment, food industries, and so on. What is the objective of this initiative? This program is to bring awareness to you people on health, nutrition, of course, wellness. Today, we have a lot of information for you, and I'm sure you cannot wait to see them coming live on your screen. Right now is our health segment. Thanks for watching. I'm Betsy Adeyinka Akinlosotu, also known as BOFA. Let's take a break. When we return, is Health Corner.
You've done so much for me, I cannot tell it all.
Hello, ladies and gentlemen. My name is Oluwabusala Akalosotu, your host for Health Corner. Last week, we discussed the types of diabetes and the effects it has on your everyday life, and we also learned ways to prevent them from my co-host, Betty Akinosotu. Now, today's category is arthritis. Let's jump right into it. What is arthritis? Arthritis is inflammation of one or more joints causing pain and stiffness that can worsen with age. Different types of arthritis exist, each with different causes, including wear and tear infections and underlying diseases. What causes arthritis? Cartilage is a firm but flexible connective tissue in your joints. It protects the joints by absorbing the pressure and shock created when you move and put stress on them. A reduction in normal amount of this cartilage tissue causes some forms of arthritis. Medication, physical therapy, and sometimes surgery helps reduce the symptoms and improves quality of life of those with arthritis. Therapies: hydrotherapy, stretching, massage, and acupuncture. Self-care: physical exercise, weight loss, tai chi, yoga, heating pad, ice pack, and cold press. Medication: non-steroidal anti-inflammatory drugs, steroid, analgesic, narcotics, immunosuppressive drugs. Surgery: hip replacement, knee replacement, and joint replacement. Now, let's look at our key takeaways. Number 1, arthritis is a severe disease that plagues people in everyday life that are just like you. This disease is treatable, but in order to be helped, you must want help. Now that we are all educated on arthritis, now I can send you over to my co-host, Betty Akinosotu, where she will educate you better on how to prevent arthritis. I'm your host, Oluwabusala Akinosotu, signing off. Have a blessed day. I love you, God loves you, and love yourself.
Welcome back from our health corner to our interview segment. Okay, please fasten your seat belts because today you're going to enjoy it. You're going to love it. I'm sure you can't wait to see who our guest is on the program today. Fasten your seat belts because today you're going to enjoy it. You're going to love it. I'm sure you can't wait to see who our guest is on the program today. All right. Fasten your seat belts because today you're going to enjoy it. I think our guest is on right now. And okay, all right, let me check I don't have it on, so okay, we're good to go. All right, today's gonna be beautiful, informative, and interactive with the guests we have on the program today. I want you to please join me in welcoming my guests on the program. It's a wonderful caregiver, a beautiful soul, nice and calm doctor, is a Nigerian. You and I would say most of you on this program know who I'm talking about. And it's Mr. Dr. Chief Adebayo Adeyinka. Dr. Adebayo is a successful, brilliant Nigerian American pediatric doctor. He had his first degree in Nigeria at the University of Ilorin, Kwara State. He traveled to Russia in 1999 to continue his study in medicine. Dr. Adeyinka completed his residency and his fellowship in US. Dr. Adeyinka is an Associate Director, Pediatric Simulation Laboratory Coordinator, Pediatric at Brooklyn Hospital Center in New York, here in New York. He was appointed as Assistant Professor of Clinical Pediatrics, Icahn School of Medicine, Mount Sinai Medical Center, New York. Also an assistant professor of Clinical Pediatrics, Wales Medical College at Cornell University Medical Center, New York. Dr. Adeyinka has a very intimidating profile, which I cannot even list all on the program today because of our time. Today, let us welcome our brother, our friend, our family, health caregiver, provider, Dr. Adebayo Adeyinka. Doctor, you are welcome on Healthy Living with BOFA today.
Thank you so much.
You're welcome, sir. How has it been like? I personally know that it's been hectic and struggle for the past 8 months of this global public health threats, COVID-19 pandemic. Let's start from there. Doctor, you are one of the frontline doctors in US on COVID-19. I know that, and it's been very tedious and hectic for you. Tell us, what should we be expecting? Because now we had it that is coming back. I'll call it return of COVID-19. So what should we be expecting, doing, and cautious of when it comes? Just briefly tell us about that before we jump right into the other questions.
Okay, thank you so much, my dear sister. It's a pleasure being on your forum and your program today. Just to touch briefly on COVID, there is some misconception about COVID as it pertains to the adult population and pediatric population. Doesn't seem as if it affects children as much as it affects adults. The incidence and the mortality, relatively is less when you compare to the adult population. While there is overall increase in the number of COVID infection in the country, the rate of infectivity is getting higher. Doesn't seem to have affected pediatrics more. On the contrary, actually, we've watched a decline in the number of patients that are admitted in the pediatric unit, which a lot of people actually don't know. Part of this we attribute to parental fear of bringing their children to the hospital because of the fear of catching COVID. We kind of are doing kind of like a research project on that as to why while there is an overall increase in the number of COVID infectivity and rate of admission for adults, seems to us that in pediatric population, the number of admission we're seeing is actually falling. So what should we do, as adults, and what should we do as children as it pertains to this pandemic? Just to follow the CDC guideline, one, is to hand washing is actually very key here. But most importantly, in my opinion, is using barrier technique, meaning like wearing mask and also practicing social distancing. Those are the 2 or 3 key factors that actually prevent the rate of spreading the infection. And this is based on purely on science. We do not say, or we do not recommend that people should not do social gathering, but it's usually by CDC recommendation to minimize it to about 10 people or less if possible. Thanksgiving is coming right now. I think it's better to be safe than sorry. The danger here is that a lot of people are asymptomatic carrier of the COVID virus, and they will not have any symptom, but you can get infected. And those that are at risk, our elderly population, mostly our grandparents, grandfather, grandmother, those that have underlying condition or what we call in the medical terminology, pre-existing condition. What are these pre-existing conditions? People that have diabetes should be especially careful. Obesity is also a very high risk factor. If you have asthma, if you've been diagnosed with asthma, you should be extremely careful. If you have like an underlying immunological
this condition or disorder, you should also be extremely careful. So while we don't discourage people from meeting loved one, we do encourage to at least practice social distancing and wear mask and then wash hand regularly with any regular disinfectant. So those are kind of the recommendation I have. I mean,
thank you so much, doctor. Viewers, you just listened to our guest, our doctor, who has experienced more than 20 years experience how to be conscious of this COVID-19 out there. We still need to keep on doing what we're doing, your mask on, and keep yourself healthy as well. Doctor, I won't ask you how long you've been in the practice, because I personally know, and I've known you for over 16 years as a very serious, dedicated, and a very industrious, hardworking person as a doctor. But can you please tell us, and I know you're a pediatrics doctor, you deal with children. Can you please tell us, when should we visit the doctor? I mean, taking our children. When is it require us to take our children to the doctor? Is it annually or quarterly or monthly?
Thank you for such an interesting question. It's interesting in the sense that visits to pediatrician is actually broadly divided into two groups. There's well child visit and then there's a sick child visit. The reason why this is done, and if you go to most pediatric offices, at least in the United States, is that you want to try to segregate the healthy kid from the sick kid. The risk of infection transmission kind of is very high when you don't do this segregation. So a visit to a pediatrician can be for a well visit, and then also for a sick visit. Okay, let's talking about we call it well child visit. Well child visit is for the pediatrician to follow up on two or three things, basically. One is to kind of make sure there is compliance with the immunization schedule, to check the growth and development of the child, to also check how the vision of the child is, to also check hearing for the child, and basically to do what we call anthropometrics, meaning that you are checking the weight, height, head circumference, and then to make sure there is nothing concerning as it pertains to that. So that is practically what is usually done in any well child visit. The American Academy of Pediatrics recommendation for well child visit is like the first one is after a child is discharged from birth is at 2 weeks. The 2 weeks is just to check on the child to make sure everything is going the way it's supposed to be. Okay. After the 2 weeks visit, then there's a 2 months visit. Here you start giving the child an immunization and doing all what I've mentioned in terms of checkup. 2 months, 4 months, 6 months, 9 months, a year, okay? After a year, which is 12 months, you do the 15 months visit, and then you do the 24 months visit. Optionally, you can do the 2.5 years visit. Some people will skip that. It's not absolutely necessary. The next is at 3 years, then 4 years, then 5 years, preschool. Then annually, after that, you reach the teenager, like it's about 12, okay? Most of the earlier visits, as I told you, are associated, with giving immunization, and that is as it pertains to the well child visit, okay? Sick child visit is usually when your child has any condition or any illness that is kind of concern to you, then you can do with a pediatrician, you can schedule a sick visit, okay? Runny nose, congestion, child is having fever. Those are the things you just take for a pediatrician to check. And then the sick child visit can be done at any time. I mean, there's no specific time to do that. For most of our kids, if you are really concerned, like if this occurred in the middle of the night, you cannot reach your pediatrician, it's recommended you take your child to the emergency room. In my career, I've had the opportunity of working in the emergency room also. We do see a lot of patients that will come to the emergency room just because, you know, the pediatrician office is fully booked and then they cannot get a sick child visit. So you can do that if you really want to, and then schedule your child to get a sick child visit. So those are what is recommended in terms of visit to see the pediatrician. During this visit, also, just to round up, if there is anything that is of concern to the general pediatrician, let's say the child is not, so these visits, the well child visit is you do a lot of screening for the child. Let's say you screen the child for speech and there is speech delay, or the child is not speaking like the peers are supposed to speak, you do a referral. There's a federal program called Early Intervention Program you can refer your patient to kind of, so that you start, you know, training and teaching them so that they don't lag behind their peers when they'll start school. Thank you.
Good. Thank you so much for this information. The reason why I asked the question is I realize that a lot of people, especially in our community, Nigerians, they don't take their children to a doctor. They think when the child is sick, that is when he will go to the hospital or clinic to see the doctor. Now you just educate us more on that. And I believe that our viewers are listening and they will make correction if needed. Moving on, sir. Doctor, I know all the doctors have a philosophy in their professions. What are your views on vaccine, antibiotics, alternative medicine, and so on? What is your view on that?
You're talking about, let's kind of split this up into several segments. Let's talk about vaccination first, okay?
Okay.
Vaccination, according to the American Academy of Pediatrics, is highly or strongly recommended for all children that meets the immunization age. This is not based on any myth, and this is not based on any hearsay. This is just based on scientific fact. The impact of immunization cannot be overemphasized, especially in countries like ours, Nigeria, where you have a lot of unnecessary death, unnecessary mortality for diseases that are at this point in healthcare development are easily treatable. And I'll mention some couple of diseases for you. Diphtheria, pertussis, or whooping cough, as we used to call it, meningitis, which kills a lot of children, polio, which causes paralysis that, you know, if we have people that still live in the villages, you'll still see 1 or 2 children that have been afflicted with polio and then that is suffering from it with paralysis. Not to talk of other conditions, pneumococcal infection, that are all easily preventable. So in the United States and in most developed countries, there's no federal mandate to giving immunization. As a parent, it's your right it's your right to determine whether your child needs immunization or not. But we strongly encourage all parents to get to let their children get immunization for one simple reason. It kind of it prevents unnecessary death, you know, preventable death, I mean, I will say. And then again, I'll emphasize this has been proven by science and then not by any fiction at all. Okay, that has to do with immunization. So my recommendation is I highly recommend it.
All right. So now, let me quickly announce this because I'm receiving a message that people cannot, you know, ask questions because a lot of viewers, when it comes to health like this, and we have a professional person coming for this segment, they always want to ask questions. And let me quickly announce it. You see a number on the screen. That number you can call in to ask our guests your questions. If you are not on our, you know, YouTube or you're on our Facebook, I'm quickly going to read out the number. Let me see if I have the number right here. It's right there on our screen. If not, I will bring the number out later. Please bear with us. We have to run through the questions. When we get to the question segment, we'll let you know. Thank you so much for watching. Doctor, now we've discussed about COVID-19, the immunization, and when to see the doctor, when to take our children to the doctor. Can you please tell us about the parenting strategies and child's emotional and social development?
Okay. Parental strategy and child physical and emotional development. That's a little bit of a challenging question to ask because, as everybody's aware, parenting is not an exact science. Parenting depends on how you are brought up as a child, what your exposure is to. It also has a lot to do with your culture. It has to do with your profession. It has to do with your personal belief and also your religious belief. On that question, it's a little bit of challenge for me to answer that. But here are some clear-cut facts that we all should be aware of. A child, I believe, is a gift from God. And part of our responsibility as parents is to give them the emotional support and then guidance that they need in the early stages of their life to be good people in life and to have a lot of values that are very important to living in a modern society. Children are different, and then they're also different personality. So one of the key things that I recommend is for parents, as parents, you need to have a very deep connection with your children. And even with me saying that with my busy schedule, that is a challenge for all of us because in the real world where everybody is out hustling, trying to provide, food and shelter for the family, we really don't have too much time to bond with our children or spend too much time with them. Half of the time they're in school, and then the other half by the time we all get back from our job or work, we're all too exhausted. So we'll just, have you done your homework? Or even sometimes you forget to ask that question because you yourself, from all the work you've done, you're exhausted. But there is a caveat to this. We really need to kind of create time to spend with our children. We need to study our children. We need to listen to our children to kind of hear what their concerns are, grievances are. This is especially more so for young girls when they are approaching that age, adolescent, when there is a lot of hormones shooting in their system and there's a lot of body changes taking place. So they need somebody to explain to them what is going on and then why these changes are taking place in them. I also strongly recommend you should always be very open about you should always have an open conversation with our children. Our culture, especially in Africa, where we come from, speaking about sex or puberty is something that is considered to be an embarrassment. So for me, when my daughter, who is kind of 15 going on to 16 now, when she started what we know as, there are three phases they go through. But when the last phase is actually the menarche, when they start having menstruation. Normally the first one is breast burden. That's the first thing that usually will occur. Sit down, explain to her what this is. These are the changes taking place in your body. You start seeing some blood, there's something called menstruation. That is what a woman goes through, at some phase in your life. It's not forever also. That just shows you're free in a reproductive age. You have to be very cautious. You have to teach them about cleanliness, how to use sanitary pads. And this is not a job for the women alone. Our culture is that, okay, it's for women, let them discuss it. So I think it's dual parenting where the father and mother has to share this. So all these are very important. So to kind of summarize, because of our limitation in time, is you need to always have an open and honest relationship with your children, just like with anybody.
Good. Thank you so much. The reason why I asked that question is, we are busy in the US, especially in this US. Our hands are so busy with one thing another, one another. Now, I want you to look at it in this way. What should I be looking at or looking out for in my children before I bring my children to you as or is pediatrics? What should I be looking out for in my children? I understand that period, puberty age and stuff. That is my responsibility to take care of that, to put them through, to educate them. But when it comes to bringing my child to you as his or our doctor, what should I be looking out for?
That's a very important question. And then this goes on to a segment where I'll call developmental and behavioral medicine. There are actually people that are trained in that aspect of medicine. So what is behavioral and developmental medicine? For some of us that have done psychology and sociology, there is the Erickson model of child development. The child passes through several phases of development. And there are some expectation in a child, as you know, that will ask parents. For those that do general pediatrics, that is your child doing this. If your child is not doing this, then that is a concern. Okay, starting from infancy, let's start from when you do your first visit for the child. Okay, is the child, peeing very well, using the bathroom very well? We expect. So I'm going to split it a little bit different. I have to talk a little bit more about this, split it. There is what is known as fine motor skill, gross motor skill, and also hearing, and then also vision. So the expectation is that like a 6 months old will be able to sit with no support. You'll be able to sit with no support. 6 months old, your child is not is still not able to sit down with no support. 7 months old, 8 months old, that's a problem, actually. Okay, that's one thing. Whereas the expectation is that about a year, about 9 months, a child should be able to stand up without support. Okay, and by a year, should start walking. So if you are not seeing all those are concern, and those are the things that you want to focus on. Most of these, will not require intervention because, there is variability in gross motor development, okay? A 1 year-old should be able to have what we know as basic gradual, able to hold. So this is fine motor skill. It's it's very difficult to develop. So if like about a year and some couple of months, the child is not able to grasp and hold stuff, that means there's a little bit of delay in the fine motor skill. By about 15 months, a child should be able to run up and down a stair. We expect like by 9 months old, a child should be able to say mama, baba, tata, stuff like that. Like about 9 months old,
Okay.
A child should start to some degree saying some words by 2 years old. Okay, at least about 50% of what the child is saying should you just be understanding some of it. By 3 years old, it should be closer to like 75%. By the time they are approaching, school age, you should understand everything they are saying. If there is a delay, and there is a scale for assessing this, if there is a delay in this, we call it speech delay or language delay. They might need early intervention. Also, we expect a child, that is very young, they should start tracking. Tracking is following with your eyes, by about 3 to 4 months. So by 3 to 4 months, they are still not tracking. That's a problem. If also hearing they should be able to respond to sound. Actually very early, 2, 3, 4 months, they should be able to, and then they will have this startle, So if a child, you are screaming, everybody is just there, not doing anything. So those are things that should be concerning. But that has to do with fine motor skill, gross motor skill, vision in terms of tracking, being able to track and identify objects, and also with hearing also. The majority of the problem with language delay or speech delay is probably because the child is not hearing very well. So if we notice that a child, is not speaking as it's supposed to speak, or is not hearing and is supposed, is not speaking, the percentage of words that the child is speaking is not enough for the age. Part of what we do is screening. Might not be hearing very well. For older kids, it's more complicated. So if a child is approaching adolescence, there are some kind of things we'll expect to hear from them. We call this the BIHEADS assessment. BIHEADS basically means, it's like an acronym for BI stands for body image, H stands for home, E stands for education, A for activities, and then D for drugs, and X for sexual activity. So those are the things we screen about. Unfortunately, well, I won't call it unfortunately because that would be politically incorrect, A child that is born, but might have different inclination as to what their sexuality is, and there are several types. You can be homosexual, you can be bisexual, you can be heterosexual, and you can also be transgender. It's very common in this country. Mm-hmm. It is also prevalent in Africa, but we suppress it. And our culture and our belief is that, this is taboo, and then it's not something you speak about, it's against God's will. There is nothing against God's will here. But I don't want to go into, because this is a very hot topic that people have their different beliefs.
Exactly.
So, yeah, but, you should screen a child for, what is their sexual preference also, what their sexual orientation is. Wow. Home environment is also very important. Are they undergoing any stress at home? Sexual activity, you should ask your child, if they're actively engaged in sexual activity. Part of this is the less you speak about it, the more they are prone to make mistakes. It's better to always have an open conversation about it. This is a very broad topic, and I don't think our time will permit us to go into everything.
Yes, that's true. You're right. Thank you so much for this information. Let me quickly tell our viewers that you can call 347 if you are outside US. You can call this number +1 347 613 5485. If you can call directly, it's okay. If not, to save the cost, you can call my WhatsApp. I'll put you on for our guests to answer your question. Thank you for being with us on this program. Doctor, let's go to diet development. We all know that we are all what we eat. And this has nothing to do with age, regardless of your age. It's what you eat, that's what you are. So now, is there any special nutritional needs requirement for a child? If there is, can you tell us?
Again, pediatric is, thank you so much for that question. Pediatric is age-based. So there are, depending on the kind of condition a child has, there are some needs for some special diet for some categories of patients. If we go to the extreme end at the beginning of life, there are some patients that are born premature. They need higher calorie relative to other children. And so their caloric intake has to be higher for them to catch up in weight. So there are several formulas that have higher calories that you can actually give the child, for feeding. It is strongly and highly recommended by the American Academy of Pediatrics to exclusively breastfeed. The exclusive breastfeeding is what is recommended. Bottle feeding is not really encouraged, and in the United States, they have lactation specialists that will train mothers on how to use the best breastfeeding technique, and these are for younger, the period when you breastfeed. As a child grow older, you start introducing solids into their food. This usually like at around 6 months when you start introducing cereal into their food. And then, when they're approaching school going age, is always better to encourage and then encourage balanced nutrition, nutritious diet. What is a balanced nutrition diet? A balanced nutritious diet is a diet that contains adequate amount of protein, carbohydrate, and then fat. It is highly recommended, and actually that the bulk of the food should be made up of fruits and vegetables. For one simple reason, there's a lot of vitamins in fruits and vegetables. There's a lot of micronutrients in fruits and vegetables. The problem with carbohydrates and then fat is that the problem with them is that the body, one, metabolizes it very slowly, and then most of it that you don't use is stored in the body, which is kind of not what happens when you have a protein diet. So excess protein is just, destroyed by the body and excreted. So to kind of have a balance, it's highly recommended you have like more proteinous diet and with an adequate amount of fruit and vegetable. This is to promote some healthy living, healthy lifestyle. It encourage it kind of the vitamins. The vitamins are very important for a lot of enzymatic. I don't want to use a lot of medical jargon. Enzymatic process that takes place in the body. Plus, the micronutrients are especially important for our immunity. So that is what, in terms of dietary intake, I'll encourage. We also will tend to encourage home cooking rather than fast food. Fast food contains a lot of preservative, and it's called fast food for one simple reason. It's just for you to it's just for them to sell, for you to kind of jack up your energy a little bit, and then but it's really not nutritionally valuable for a child. So we strongly recommend home cooking for children in terms of the nutrition that they should be getting. Thank you.
Thank you so much, Doctor. We have a question coming from one of our viewers. That's from Engineer Bosoye Olalere. I want to take you back to COVID-19, discussion. The question is, it says, what is your view on the superior management of COVID-19 pandemic in Nigeria compared to the US amongst children?
Superior.
Management.
You mean, if I'm to understand that question correctly,
I think it's trying to know that how is it taken care of or handled in Nigeria, in the US compared to Nigeria. That's the way I understand the question. But
yeah, I kind of get the gist of the question, but really, I don't think there is a difference in management of COVID-19, whether it's in Nigeria or whether it's in the United States. Perhaps the real question is that, is there adequate or is there enough supply of medication to treat this disease in Nigeria relative to America? If you're talking about America, yes, all the medications are available to treat this, and people are getting it if they need it. The standard of care for treating COVID-19, depending on the severity, is to use remdesivir. Remdesivir is an antiviral drug that we use to treat COVID-19 infection. That's actually the top tier drug. Also, we use azithromycin and hydroxychloroquine. There's a lot of controversy about the hydroxychloroquine. It seems to work in some certain group of people, and some other group of people, it doesn't work. There's not a lot of data out there. There was a time there was somebody that posted a video online that a lot of people were asking me question about Nigerian trained Cameroonian doctor that was touting, the efficacy of hydroxychloroquine for the treatment and management of COVID-19 infection. most of the information this person was providing is false, and there's no scientific data to actually back it up. Not a lot of people were kind of following that, but really, if you listen to most of the top scientists in this country, there's really no scientific basis to back that up. But in terms of treatment of COVID-19, whether it's in Nigeria, China, Ghana, Ivory Coast, Mexico, Nicaragua, there is a standard of care for those patients in terms of the medication they get. If they do go into respiratory failure, you put them on life support machine, mechanical ventilation. Now, there might be a challenge with that in Nigeria, that we don't have a lot of those sophisticated machines to treat those patients. And even if we do, because I do a lot of global health, and it's a challenge, with electricity supply in Nigeria. So if a patient goes into respiratory failure because of COVID-19, it's not as if the doctors in Nigeria don't know what to do. But then the bigger question is that, do they have the resources in their hand or available to carry out their work? You put a patient on, you intubate a patient, that is putting a breathing tube down the tube, and you hook them up to a machine in a teaching hospital, a general hospital. And then, NEPA as usual takes off the light. The patient will die, obviously. So that is why there might be more mortality in Nigeria relative to the United States or other developed countries. It's not because they don't know what to do, they just don't have enough resources in their hand to handle the situation.
Wow, you're right. Thanks for answering that question. And I believe our viewer, Engineer Bosoye, get it right. Moving on. Let's now move to movement, and that is physical activity. I have one question for you right there. And the question is, should there be any physical activity for a child? The reason why I'm asking this is our foundation serves persons living with disability, and we have a lot of children in this, in this group of people, in this community. And I kind of going home regularly to give them, kind of coaching, both on health and on nutrition, which we have other health professionals that follow us and, join us in this. And should there be a physical activity for a child? If yes, how much physical activity should a child get each day?
Okay. Physical activity is actually highly recommended in the pediatric population for one simple reason. It's one of the way of promoting a healthy lifestyle. Again, there is a lot of myth, and there is also a kind of culture as it pertains to this. Living in the United States, as you see children, is quite different from living in Nigeria. By the way, in my opinion, children in Nigeria get as much physical activity as they can get to some degree, and I'll explain to you the reason why. I don't think it's changed because I still go to Nigeria regularly. Most of us still walk to school.
And that's considered physical activity, though.
That is a lot of physical activity relative to here, where even if a school is around the block, you'll have kids, being picked up by school bus. So I remember, even though it seems far, my first daughter, where she went to a private school when she first started, schooling, it's a walking distance, in my opinion. That is how we used to walk when we were children, when I was going to elementary school. So walking is actually one of the least strenuous and then one of the most easily carryable and physical activities. So I think that is what I will encourage and promote amongst children, because walking will promote your muscle to work. You are not actually doing the highs and low where, for a short period of time, you just go to the gym and do exercise, you burn a lot of calories away, and then, you accumulate that calorie again. Because walking is like an everyday activity. So that's one of the things I actually encourage. Just regular walking, as it's recommended for adults, so it's recommended for children. I do that also a lot. I'll find time to walk around. Also, one of the things that I will encourage, and again, because of our condition in Nigeria and Africa in general, we tend to do that without actually knowing it. Okay, in a high rise, if somebody works in a high rise, 5, 6 stories, most of them don't have elevators. So you have to walk up and down the stairs. So unconsciously, you don't know, but you are doing some physical activity for yourself. Here in the United States, it's the opposite. The elevator is all in all high-rise buildings. Any building more than 4 or 5 stories, we usually have an elevator. For me personally, when I'm at work, I kind of, it's an habit I've inculcated right now. I just use I walk on the 5th floor, so I just walk up the stairways every day. So it's you don't think you're exercising, but you are really exercising. By the time you get to the 5th floor, you do it twice, you're out of breath. You've burnt whatever you're feeding, you've burnt it away. So to me, I'm a firm promoter of subconscious exercise, where you do it without physically straining yourself, but it's contributing to your ability to burn away those calories.
And that will take us to health measurement. Let's talk a little bit about health weight assessment.
Yes, thank you.
Now, what is the normal BMI for ages?
Okay. Thank you so much.
And I want you to please, because I have a lot of obese in my surroundings, my friends and family, bunch of them, and I keep telling them, this is what you do, this is what you do. Maybe when I'm not a doctor, maybe they will believe from you if you say it now. They are watching us right now.
Yeah.
Go ahead, sir.
Thank you so much for that question. So first and foremost, we have to understand this concept about BMI. So what is BMI? BMI is an acronym for Body Mass Index. Body mass index is basically the ratio of your weight in kilograms, some will use pounds, to your height in meters squared. Okay? Why did they come out, or why did scientists come out with that idea of BMI? For one simple reason. Okay, if you take somebody that weighs 80 kilograms, but it's about 1.2 meters in height, and you take somebody that is 80 kilograms and is 1.7 meters in height, okay, there is a big difference in their BMI. The shorter person will have a higher BMI. The fact that you might think that the taller person has a lot of weight, his height has compensated for that. So that is where the concept of BMI comes into being, is to compensate for the weight gain based on height, so that there is a proportion between the posts, between both. So so BMI is an accurate assessment of it's an accurate assessment of how the weight of a person is related to the height, and it's actually a very good statistical measure for determination of whether somebody is underweight, overweight, obese, or morbidly obese. Okay. So in the United States, let me talk about pediatrics, and then I'll talk about adults also. So in pediatrics, so we have a chart. So any patient admitted, regardless of the condition for admission, will have a BMI. BMI usually is done from the age, or in pediatrics, from, you don't do it for younger kids. You start from 2 years to 18 years as it pertains to pediatric. 18 years and above is for adults. Okay. So if you really look at the graph, and then for those that are really interested, and you can do yours actually, also, if you look at the graph, there is what is known as percentiles. What are percentiles? And I want our audience to really understand this very well. Percentile is that not human beings, we all come in different shapes and sizes. So the percentile is to give a wide distribution for the BMI. So you can be at the 5th percentile, the 6th percentile, the 7th percentile, the 8th percentile, the 9th percentile, the 10th percentile, 99th percentile, 100%. What does that mean? So this simply means that, at a particular percentile range, those people, the people below that, kind of maybe weigh less than you, and a percentage above that weigh more than you, okay? So let's say somebody has a BMI, I'll just pick a number. Let's say like a 30-year-old woman has a BMI of about, 40, okay?
Mm-hmm.
40 means that you are above the 100th percentile. So meaning that, you are grossly overweight, like nearly in that range of your age, most people or almost everybody have a BMI that is below yours. Okay, I'm hope I'm making some sense with this. Okay,
Yes.
now let's go further and then talk about what is a normal BMI. The way BMI is that usually if you calculate the number, roughly is between 18 to 24. 18
That's
to
for
24.
the children, right?
Yeah, that's for children. In adults, it's a little bit higher. So, and I'm going to talk, because that's what I'm mostly familiar with, in pediatric population. So normally, the BMI, if you are, if you're like around your BMI is about 18, that will kind of fall within normal range. If it's also around 24, that will fall within normal range. So what is considered to be underweight, if your BMI, if you plot that number, so it's like a graph like this, and then you plot it, and then you put your number based on your age, it will fall within a certain percentile, okay? If your weight or your BMI falls around or below the 5th percentile, that means you are probably, underweight, okay? If your BMI is between the 85th to 95th percentile as it pertains to pediatric patients, that means, you are overweight. That doesn't necessarily mean you are obese.
Okay.
If your BMI is above the 95th percentile, then you are obese. And then there are certain categories of obese. You have mild, moderate to severe obesity. Anything like above 30, in most age range is considered to be abnormal. You can do a simple calculation, just go online, know your weight, know your height in meters, okay? Know your height in meters, and then just ask it to calculate for you. There are several apps or several, and it will just tell you. And the good thing about this is that it not only tell you, it will tell you under what category you fall into.
That's right.
It was very surprising for me. I'm a little bit overweight for my height.
Me
So
too,
the
from
fact
my-
that you look, the fact that you think you are slim doesn't mean you are
That's true.
you are not overweight. Okay.
Overweight.
Now,
That's true.
one thing I also want to mention that we also have to be aware is that there is a little bit of variation in this. When the BMI was developed, and as it was developed for people in the Western world. Different cultures have different body habits. So this was based using number for a Caucasian population. They populated a lot of people and then they use it. There has not been any statistical data to kind of pull, like, for example, Nigerians and then kind of determine BMI and then find what is appropriate. So all this is based on what was done on Caucasian population. But regardless, it still transcends and it's still applicable. So if you're obese, you are just obese, and then just kind of work on it and then watch your health, okay? Simple way to calculate, just go online, put in your numbers and then calculate it and it will tell you. There are several links that I can send to the host that can be used for this. It's all online on Google.
So it's okay to say that if our child is overweight, we should be concerned about it.
Yes, there should be a lot of concern with, go ahead.
And what should we do? Should we place them on diet?
So when you deemed, and actually that's the job of the pediatrician. So what are the risk factors with obesity? There is a lot of, actually with being overweight and having obesity. There are several risk factors associated with this. One, and the foremost is that obesity can lead to other condition. It can lead to early hypertension in child. There is hypertension in children. You can get hypertension. You can develop what we call metabolic syndrome. Your cholesterol will be very high. Your low density lipoprotein will be very high. Your HDL, high density lipoprotein, will be very high. All this will lead to early atherosclerosis at a very young age. And what does that can lead to is like a stroke, myocardial infarction as you get older. Obesity kind of reduces your insulin sensitivity. The insulin are not that sensitive, so that can actually lead to what is known as type 2 diabetes. In fact, in the United States, the prevalence of type 2 diabetes is rising higher and higher. Exactly. What else can, being overweight and being obese cause? You can develop what is known as obstructive sleep apnea. You will snore a lot. You'll see all these young children, some of them will start snoring, which is not normal and is not expected. Okay, they can develop what we call also SCFE, which is sleep capital femoral epiphysis. It's really not a bone fracture, but it can cause them to limp. And other conditions also, but both are the most important one that you can encounter. So how do you counteract this? First is the first thing to do for obesity is promoting healthy lifestyle. Really, you don't treat with any medication. Promoting healthy lifestyle, diet and exercising, walking more. If you are into sport, we encourage, to do sport, basketball, football, boxing for boys. There's a lot of physical activity and sports for girls too. And then changing the eating habits also. How your child eats is a reflection of how you eat, because your child will follow your pattern. So if you don't have healthy eating lifestyle at home, if you like to buy your children a lot of fast food, that should be highly discouraged, and you should cook them more home-cooked meals that are more nutritious and it's more beneficial to them.
Good. Thank you, doctor. I have one question from the viewer, and it says that because of COVID-19 we discussed, and the person is asking that, will you say that people in Nigeria are more healthier because of the lack of fast food compared to the US?
I won't say so, because if you really, first of all, that is a paradigm that is really changing. My visit to Nigeria, I grew up in Nigeria. I left quite a long time ago, but I've been going more frequently now. You see almost all the fast foods that we have in Nigeria, that we have in the US, also in Nigeria. You will see Domino, there's McDonald's, you'll have Eddie King Burger, those are fast food joints, it's not as rampant, or it's not as rampant as you have in the United States, but it's there. And more people, is the cool thing to go to a fast food restaurant. Most of these fast food restaurants, regardless of how nice and then attractive the food is really not healthy, because most of them are processed food with a lot of preservative. Now, let's put that aside and look at some of the fast food. So fast food joints in Nigeria that kind of serve authentic Nigerian dishes. If you had the opportunity of tasting some of those food, you will vomit if you really kind of it's tasty, but the amount of salt that they put into it to make it more attractive to is horrendous. Yes. And one thing they like to use a lot here and in Nigeria also to make the food tasty is monosodium glutamate. They use it a lot. It's a very unhealthy salt. So I won't say our food is healthy. There's some good stuff in a national cuisine that is good, but there's also a lot of stuff that is bad. Some of our food or preparation of, especially the Yoruba, even Igbo and other cultures, palm oil. It's not the healthiest, palm oil that we use in a lot of you can attest to that, you're a dietitian yourself. It's not actually the best, but we use that. So, and then you see the same rate of, atherosclerosis, stroke, hypertension. It's also very prevalent. A lot of people use, a lot of salt in their diet, actually, in Nigeria.
True. That's Nigerian for you. They use a lot of salt and also vegetables, red oil.
Yes, palm oil, palm oil.
Yeah, it's gonna be floating like you don't have nothing underneath.
So yeah, and then you have to skim it off, but that is, if you go to most of this mama put joint, that's what you see,
That's true.
the mama and then the shaki and their
They
body
have
will
no
be floating, in a river of palm oil.
Mm-hmm. Thank you so much, doctor. It's been wonderful. And lastly, can you just give us advice as parents to round it up? What is your advice for us, especially this time that our kids are online, home learning? Just give us a random advice. Thank you.
Thank you so much for giving me the opportunity to participate in your forum. It's been a pleasure and an honor, and I hope I'll be able to serve in this capacity as time goes on. We are living in a different world. It's a different world for every one of us, for those that are in Nigeria, for those that are here. Our parenting has actually extended to actually being home tutors for our children. We wake up, we send our children to school, the teachers deal with these children for about 6-7 hours in a day, then they come back, and in our mind, all this is done. But right now, we have to supervise these children, and it's not as if these children that we are supervising, they are doing like virtual learning, they are on Zoom. I mean, even though attendance and rosters are taken, but it's not the same. So my advice as parents is for us to be more aware about the positives and negatives of this. The positives about this is that actually is virtual, and then it's a little bit more convenient if you look at it. But then it's also fraught with a lot of problem in that, especially for the younger kids, they get distracted easily. And there's really no way for a teacher that is doing virtual learning for about 20 pupils to actually keep a tab on everybody that you are watching the video screen. You'll do your job and you leave. So as parents, we need to be more cautious about this. For the younger kids, some people will recommend because you also have to work, to provide food for your family, to get an extra video. I have 1 or 2 or 3 people that actually have a video that will monitor as the children are doing their homework. Because once they know nobody's watching them, they can switch off the screen and then they won't do that. So that's a challenge for a lot of parents, and then, how do you juggle between your work and then also trying to do homeschooling for your children? So it's a challenge, but, it's a paradigm, or it's a new norm that we're all dealing with. So better supervision, have a dedicated time, to speak to your children after the end of the day to kind of learn what they've done, just the same way we are doing it when they are still attending school. Yeah. This might be the norm for the year coming, but because I believe, the spike in COVID is still going to go higher as we approach, at least in the United States, winter. So the expectation, always hope for the best, but prepare for the worst, Just expect that for this year, our children might end up not going to school and will pass this academic year by just doing virtually learning. Prepare for it very well. Use some online resources for your children. And then, go online, research, and then find out how other parents are dealing with it, because every parent's story is different. This is even more challenging for single parents, especially in this country. Yes, So that is my advice. And then, hopefully God will protect all of us and keep us safe.
Thank you so much, Doctor. This is all for today on interview segment with our experts. I want to say thank you to Dr. Adeyinka for taking your time to educate us today, especially on health for our children and in general. We do appreciate your time on the program today. I say God bless you and continue to strengthen you. We hope to have you more on this program very soon. And thank you so much for always saying yes to my call. I'm so happy. I'm so honored. God will honor you. Thank you so much.
Thank you so much.
Bye-bye.
It's a pleasure.
It's a pleasure.
Bye.
Bye.
Thank you.
Bye.
Bye.
Yes, our viewer, it's been informative and interactive today with our guests, Dr. Adeyinka, on interview segment. Right now is a nutrition segment, and we've all been educated on what arthritis is today. Let's look at the foods that reduces and prevents this inflammatory disease called arthritis. Food is medicine. We all know that. For some people, it is medicine. And for those of you that have a chronic inflammatory disease, it will help you in one way or the other. But trust me, once the disease is diagnosed, it's very, very risky, or it's going to give you a little, a small amount of assurance to get it through or to get over it with food, with your diet. So let's quickly talk about the food that will reduce and prevent arthritis. If you are struggling with pain from arthritis, eating food that have antioxidants, anti-inflammatory, and analgesic properties will help you. Here are the foods that can help you ease your arthritis pain. Number one is omega-3. And this omega-3 is known as fatty acid. Fatty acid, which has, potent anti-inflammatory effect. You can get it from fatty fish. Variety of fish such as salmon, mackerel, tuna, and sardine. I need to let you know this, that the study also showed that taking omega-3 fatty acid supplements decreases joint intensity, morning stiffness, and the number of painful joints. Fish also is a good source of vitamin D, which can help prevent deficiency. Now, let's go to the second food you want to experiment on, and which is green tea. Green tea is known to be very high in nutrients and antioxidants, and it has the ability to reduce inflammation. You want to have your tea bag, not the powder tea mix. Why? Because the powder tea mix are more processed. If you drink the caffeinated variety, make sure the process is all natural. The next food is fruits. Of course, we want to live on fruits and vegetables. Fruit like berries. What are these berries? Blueberries, blackberries, strawberries, cranberries, raspberry. All provide arthritis fighting power. You want to live on apple. Eat apple. Apple are also high in antioxidants and a good source of fiber. We have one fruit. I'm not sure if you can get it in Africa. It's called pomegranate. Pomegranate is a kind of fruit that have tannins which can fight the inflammation of arthritis. So all these fruits, you want to experiment on them if you are suffering from arthritis. Of course, vegetables. Vegetables like cauliflower, mushrooms, Brussels sprouts, broccoli, and so on. In either frozen or fresh, they are all good to go. You can eat them. And also there are a lot of vegetables you can also eat that is called leafy vegetables, like ugu in Nigeria, like efo shoko, tete, and so on. I can't remember all this Nigerian vegetable anymore. But if you live in the US, you can live on kale, collard green, spinach. These are vegetables you can eat if you are suffering from this inflammatory disease. which we call arthritis. The next one you want to eat is canola and olive oil. These two oils have a very good balance of omega-3 and omega-6 acids. Both of them are essential fatty acid, a component in olive oil called oleocathols, which has anti-inflammatory property. It's a very strong oil that you want to use both for your food, to rub on your body, and the area that you have your arthritis. Try to use this olive oil. It's a very powerful. I use it myself. I use it to rub my skin, to every part of my body. That's what I use olive oil. And it's a very strong and beautiful oil that you can use to glow your skin as well. The next one is ginger and turmeric. We all know that ginger is an anti-inflammatory property. Scientists even recommended it. To take it daily, weekly, monthly, whichever way you want to take it. Take it. It's a very good root. Ginger and turmeric, very powerful property. And I advise you take small amounts of ginger if you have an upset stomach as well, to help you settle the ache in your system. The next one I'm going to talk about is nuts. I live on nuts. My food is nuts, grain, vegetables, and fruits. All nuts are very high in protein, low in saturated fats, and contain no cholesterol, unlike animal proteins. It helps arthritis if you eat them alone or add them to your favorite yogurts, salad, or healthy dish. This will boost your protein anyway. You can substitute this nut with meat. You know why you're going to substitute it? Because you have protein. You also get fatty acid, which we call omega-3 from nut, which this meat will not give you. So you want to experiment on nut. Now, in recap, here are the food for arthritis: omega-3 and 3 and 6, nuts, fruits, vegetables, turmeric, ginger, canola and olive oil, and lastly, green tea. I hope someone is blessed with health tips today on Healthy Living with BOFA. I want to say thank you to all our viewers. I want to say God bless you for being on the program today. It is not by our power, nor by our might, but by the grace of God and you being online to support us. I want to say big thanks to you. God bless you. I'm still your host, Betsy Olayinka Folarin Akinlosotu, aka BOFA. I'll see you next week with good health. Be safe and healthy. God bless you. Bye.